Hi, welcome along to our third video chat of the month of September for Pulmonary Fibrosis Awareness Month. I'm delighted to be joined today by Angela Perillo from the American College of Chest Physicians. Welcome, Angela.
Hi, good afternoon. Welcome. Thank you so much for having me. As you mentioned, my name is Angela. I'm with the American College of Chest Physicians, but specifically work on our foundation side of things. So I'm Director of Development and Foundation Operations with the Chest Foundation. I started with the foundation about a year ago, and as we're gearing up for our chest meeting in 2018 this year in San Antonio, I think about us that I just had started when we were doing our meeting in Toronto. So it's been a really exciting year here at the Chest Foundation. One of our big passions and things that we've been working on is being in the pulmonary fibrosis space, with not only working with our partners, such as the Pulmonary Fibrosis Foundation, Team Jeffrey for PF, the Feldman Family Foundation, but also to be creating some amazing pieces and educational pieces such as webinars and different patient education guides that we hope to use for resources for not only our chest clinicians to present to their patients, but that to be also a great resource for patients and their caregivers to bring back to their clinicians to keep that open line of communication going on between the two of them. So thank you so much for having me. It's Global Awareness Month, so I know it's very, very busy in the pulmonary fibrosis space. I recently was with the Pulmonary Fibrosis Foundation.
Yeah, I was just about to say, so you've been in the space a long time. So tell us about your time at the Pulmonary Fibrosis Foundation.
Sure, yeah, absolutely. So I had my work there gave me the amazing opportunity to really have a chance to go and speak with patients and with caregivers and with families that are dealing with this disease every single day. You know, I mean, it's very scary and terrifying to see someone that you love not be able to catch their breath or even be able to breathe or do regularly, daily things such as, getting up to get yourself ready in the morning, and seeing, kind of how the disease takes over. Just recently, I had a very close friend diagnosed with pulmonary fibrosis. So this awareness month for me has been kind of personal because he just recently got diagnosed in August, which I guess if there's a timely time to be diagnosed with pulmonary fibrosis, which I don't think there is, but if there were to be one, it would be right before Awareness Month, because there's so many resources available and there's so many people getting different proclamations all over the United States and also internationally, and it's really a time where people are creating as much awareness as they possibly can. So my goal while I was with the Pulmonary Fibrosis Foundation was really to interact with, patients and caregivers. And when you are dealing with the disease or you lose someone from the disease, you kind of feel like, okay, now what? And what can I do to make things different? And what can I do to help? So I try to create a bit of an avenue for those people to, whether it was have a car show in memory of their loved one, or just to, have a get together just to celebrate in honor or in memory of that person. That was kind of my role there, which interestingly enough, I still have that opportunity to do so here at the Chest Foundation. It's just looking at it from a kind of a flipped view from the clinician's perspective, and how we can really make sure that patients, patients learning information about this disease, they're as proactive as they can possibly be when meeting with their clinician. And that on the reverse, that clinicians can also offer as much information to their patients. So it's been a really interesting career so far in this space.
Yeah, because quite a number of patients I've spoken to, and the last video chat we did was with Mike Olson, and when he was diagnosed, he was told, like many others, in the years gone by, to go home and prepare to die. And fortunately, that doesn't happen so much anymore,
Sure.
because there is things that patients can do, and there is options for some in terms of lung transplant. And I know a lot of the work that CHEST is doing is to try and collaborate with the Pulmonary Fibrosis Foundation and others around those education initiatives, both for physicians, pulmonologists, and patients.
Yeah, absolutely. So, you know, one of the things that we're definitely doing is working in the space of, so that it's more educational based. So we had kind of speaks well to the example that you just gave of Mike Olson's diagnosis, where people are receiving that diagnosis and then you know, you start going on the internet and trying to figure out all this information and probably scaring yourself even further. So one of the things that we created this last winter and we hope to continue to do as we move forward through the end of 2018 and into 2019 is a whole webinar series. We focus on lung diseases across the board. So pulmonary fibrosis is one that we hold, that we have a high consideration to. So we had a group of clinicians, Dr. Greg Cosgrove, the CMO of the Pulmonary Fibrosis Foundation, Dr. Dave Lederer was part of it as well. We had an amazing patient, Carolyn Adams-Duda, who I'm going to give a shout out to. She's going to be running the Chicago Marathon this year. I'm so excited for her. And Michelle Peters from Team Jeffrey for PF, and Patty Toomey, the previous CEO of the Pulmonary Fibrosis Foundation and still a PF advocate. We had them all join together and do a webinar and just kind of talk about what happens when you get that diagnosis. You know, what type of information should you be asking? And it was a really interesting webinar, and happy to share the link. There's my plug, of kind of hearing both different sides of it. So things that you can think of that as a patient, what your doctor could be, you know, kind of what you could be thinking of to tell your doctor, and then also vice versa. We also just created and completed our ILD patient education guide, which we've been able to also use that as a resource for, you know, our clinician offices, so that they have a resource and a tool to move outward in. We do events with our different partners. So we've got the Feldman Family Foundation that we do an event with. Team Jeffrey for PF is doing an event. I'm sure, I think Michelle probably mentioned it in her video that she was talking about. I know the PFF has their walk coming up in a few weeks. Oh my gosh, I think it's actually next week. September is flying by. So there's a lot of different things going on that I think the CHEST Foundation is really proud to be a part of. You know,
the CHEST meeting at the month.
I was just about to say, we have our large meeting coming up, where we kind of, all of us are going to be able to have the opportunity to come together and really talk about how we can push things forward moving into 2019 in the pulmonary fibrosis space. I think one of the things that you and I had the opportunity to when we met in May was to really take a look at your app and how that really is a tool for pulmonary fibrosis patients. And I can't wait to see where our partnership is going to kind of go moving forward. But it's, you know, it's great for people who are pre-lung transplant and post-lung transplant. And also the new tool with caregivers. I think that's a great opportunity because so often I think the caregivers forget about caring for themselves as caregivers because they're so focused on making sure that their patient and their loved one is taken care of. So I think the app is a really great opportunity, and a free opportunity because let's face it, things are really expensive when you're caring for one who has pulmonary fibrosis. So I think that the app is a really good opportunity for us to also engage the pulmonary fibrosis community, and for a way to have them have a helpful tool just to kind of keep them like moving along every step of the way.
Yeah, when I spoke to Michelle just in the last week, you know, we talked about kind of what are the things a caregiver needs to know. And I think you're right, too often people don't talk enough about the caregiver and the stress and the burnout involved in being a caregiver of anyone battling an illness, let alone something like pulmonary fibrosis. So, you know, I think that's
absolutely
a really good perspective as well. So tell us about plans for 2019 and other initiatives that you're planning.
Sure, yeah, absolutely. So we have our lung health experience that actually has, it kind of looks at lung disease and lung health overall. So it focuses on pulmonary fibrosis, COPD, lung cancer, asthma, and it's really our community outreach opportunity for people who may or may not be even aware of their lung health, or even have had an opportunity to learn about their lung health before. So our next one coming up will be in conjunction with our CHEST 2018 meeting. It'll be taking place in San Antonio, Texas on Saturday, October 6th. And just a really quick rundown. We have our clinicians and our leadership that come in and they do spirometry testing for anybody who'd like to participate. And then there's a whole virtual patient tour where we teach participants what your lung capacity looks like and what a healthy lung looks like versus one that might have, like, say, asthma or COPD. And then we have all of our partners, both and all different lung disease states, that give an opportunity to really talk to the advocacy groups that are working with patients and caregivers on a daily basis. So that's going to be taking place most upcoming. It's literally a month from today. We have our CHEST 2018 meeting where, again, we're going to be collaborating with our pulmonary fibrosis partners. We hope to do additional webinars throughout the year that focus on different areas that pulmonary fibrosis patients and their caregivers want to know about. And we'll have some different events coming up. There's the 6th annual Irv Feldman Poker Tournament taking place in Chicago on March 2nd of 2019. So there's a lot of different things happening in the pulmonary fibrosis space. And then we also have, locally, we have our Suburban Lung Health Group with Dr. Ed Diamond and Kim French, who are both lung health champions in our foundation, that they want to continue moving things forward with maybe having different clinician-based sessions, where it's really an opportunity for clinicians to get together and kind of just talk broadly about, kind of their experiences and how they can continue to move things forward. So a lot going on for the end of this year and as we move into 2019. For more information, you can always check out our website and, feel free to share my contact information with everyone.
Certainly will do. I think for a lot of people with PF, it's good to hear about these initiatives throughout the year, because often people say, what happens at the end of September, so it's,
sure.
These
yeah.
initiatives and the work you and others are doing is year long.
Absolutely. I mean, yeah, September's great. I'm bluing it up. I got my blue on. But I think it's also, see, we're bluing it up, yay. But I think it's also, like you said, it's not just a 1 month, although that's amazing that we have an awareness for pulmonary fibrosis, but it's really what we're continuing to do for the entire year to push the progression forward of, creating better quality of life for patients and caregivers.
And of course, the other extremely important thing about the CHEST meeting is, all of the amazing talks which are geared to the pulmonologists, but it's really about sharing best practices among pulmonologists worldwide, because it's very much an international meeting now, the CHEST meeting.
Absolutely, yeah. We have, there's sessions beginning, I think on Sunday morning they start and go all the way through Wednesday. So there's really an opportunity for clinicians, and like you said, all over the world, internationally, we have people come to the meeting and really have an opportunity to see what's going on guideline-wise, what's cutting edge, what, kind of what's been studied on over this past year, and then an opportunity to get together too. So we're really excited. It's a busy few weeks ahead, but we're really excited for the meeting, and I'm proud to be part of the pulmonary fibrosis space.
Excellent. Well, I'm really looking forward to the CHEST meeting. So
yay, we'll be so excited to see you.
Looking forward to seeing you in San Antonio in a month's time. And thank you for sharing everything that CHEST is doing to help raise awareness of pulmonary fibrosis.
Absolutely. Thank you so much for your time, and thank you for the opportunity to share our news.
Great. Thanks, Angela. Take care.
Take care. Have a great one.
Bye-bye.
Bye.